Alright, now we will move on to part 2 for Neurobiology of Stimulants for ADHD. Welcome to episode 178. Alright, so dopamine pathway relevant to ADHD. The brain contains several dopaminergic pathways that regulate cognition, motivation, behavior. As well as in ADHD, the most relevant are the Mesocortical and mesolimbic system. Alright, it might be a little boring for you guys, but for the ones that really care or understand, there we go. I'm still learning. Mesocortical dopamine pathway. It originates in the ventral tegmental area, VTA, and projects to the prefrontal cortex. The primary function, as I mentioned in the last episode, are attention regulation, executive function, decision making, as well as working memory. The role in ADHD is to help signaling in these pathways in association with poor concentration, impaired planning, difficulty maintaining goal-directed behavior, as well as other executive functioning symptoms. The medication effect stimulants such as Adderall increases dopamine and norepinephrine activity in the prefrontal cortex, improving cognitive control. Second, mesolimbic dopamine pathway. Now, it begins in the ventral tegmental area, but projects into the limbic structure, including the nucleus accumbens. The primary function is for reward processing, motivation, as well as reinforcement learning. The role in ADHD is to lower the dopaminergic activity, which leads to reduced motivation for low reward tasks, as well as increased reward-seeking behavior and impulsivity. The contributions to the tendency to seek immediate stimulation or novelty is normal in terms of this symptom in ADHD, which I also have. Number 3, nigrostriatal, this is why I'm not a doctor, pathway, secondary relevance. It originates in the substantia nigra and projects to the striatum. The functions are motor control and habit formation. That's very important for habit formation because that also kind of overlaps with motivation. And once you start, you force yourself to get out of that negativity box, which I'm going through, obviously, but I'm not talking about myself. ADHD tend to get themselves worked up over, something maybe could be smaller than they think. And for me, obviously, I freak out for everything. I know where I put my stuff, but I just very clumsy and forget to take them. And then I freak out and, make something very small turn into something big. And yeah, that did hurt my heart. And, but with the other factors, involved, always talk to the doctor. Always talk to your doctor and your psychiatrist, your psychologist, whoever it is that's helping you with your medication. All right, so simplified functional comparison like we did. The 3 dopamine pathway is mesocortical, mesolimbic, as well as nigrostriatal. So lastly, the key takeaway out of all this boring medical stuff is it's not boring for me. ADHD is increasingly understood as a network level dysregulation of dopamine and norepinephrine signaling, particularly affecting the frontal circuits. Medications such as stimulants tend to restore the optimal neurotransmitter levels within these pathways. I'm sorry, my pronunciation is pretty bad. And like I said, that's why I'm not a doctor, even though I recognize the words on the phone. All right, talk to you guys later. Take care.